coverage covers a range of health benefits for its participants. Today we're going to dive into the ABCs of Medicare to really go through each section. The first is Part A. Part A is your hospitalization coverage under Original Medicare. This coverage is going to allow you to be taken care of if you are in an inpatient care situation at a hospital, a home health center, rehabilitation centers, and some hospice situations. The second part is Part B. Medicare Part B is also a core coverage for Original Medicare. Part B is your medical coverage. Think of this as the things that you will use day to day for your preventative cares for your primary care physicians, lab work, emergency rooms, and some durable medical equipment. Part B does have a fee attached to it, and that will be assessed based on a 2-year look back at your modified adjusted gross income and paid monthly to the government or quarterly if you're going to pay by check. The next is Part C. Part C is an optional coverage offered through private insurance investors and regulated by the federal government. Part C brings together a various amount of networks, doctors, and pharmacies to allow you to optimize your coverage of what's coming out of pocket. With Part C, we also refer to this as Medicare Advantage. For these coverage options, you will pick which insurance carrier you'd like to cover you, and then go with a network that will have the doctors that you want to be able to see when something occurs. Oftentimes, Medicare Advantage comes at low or no monthly cost to you, and you pay as you go. You're going to have co-payments, co-insurances, and different various fees that may come up. With a network, you want to make sure that you're staying with a provider who is covered to minimize your costs. Additionally, Medicare Advantage often has things such as prescription drugs, dental, vision, and hearing preventative services, gym memberships, and Part B givebacks to help sweeten the pot. The other option that you have is Part D, prescription drug coverage. You would pick this instead of or in lieu of Part C to help make sure that you have creditable coverage. Once you turn 65, you're required to have creditable coverage at all times. Creditable coverage is when you have insurance that is the same or better than Original Medicare. With Part D, you're getting prescription drug costs that are going to cover the maintenance medications that you take daily and also anything that comes up when you get sick. With a Part D, you often partner this with a Medicare supplement or Medicare gap plan to make sure that the gaps in your coverage are all taken care of. Through these pieces, the government wants you to be as covered as possible for when, not if, life happens. We know there's a lot to digest there, so please give us a call to help at Magellan Healthcare today.